Right now on Good Morning Washington, it's time to get moving. For the next 30 minutes, we're spotlighting treatment for low back pain that is changing patients' lives. From top physicians,
This is what was causing all the symptoms.
to real-life patients.
I feel like a person who doesn't have any aches or pains.
Don't live with chronic back pain.
I want to live as long as I can, but I don't want to live and be uncomfortable.
It's time to know your backstory. This Good Morning Washington Pain Awareness Month special starts right now. Pain Awareness Month on Good Morning Washington is sponsored by Know Your Backstory. And we welcome you to our Good Morning Washington Pain Awareness Month special, where we are putting a spotlight on back pain. A recent Harris poll estimated 72.3 million Americans suffer from low back pain.
Yeah, and we are so happy to have Dr. Mark Coleman, President of Clinical Operations at National Spine and Pain Centers, here to answer all of your questions. He's also going to be telling us about the mild procedure, which is a minimally invasive procedure that is changing patients' lives. So why don't we first start, Doctor, welcome to our show.
Thanks for having me.
Why don't we start with the Know Your Backstory campaign and what that is?
Yeah, well, the Know Your Backstory campaign is a national health awareness campaign focused around the idea of chronic low back pain, and specifically a particular type of low back pain that's caused by a thickened ligament in the low back that causes back pain radiating into both legs.
So let's get into some viewer questions here. And what is chronic low back pain and what causes it and who suffers from it?
Well, chronic low back pain is back pain that exists for any more than 12 weeks. And specifically, lumbar spinal stenosis, which is the focus of this campaign, is a type of back pain that's caused by an enlarged ligament in the low back that causes pain in the back and down both legs, and difficulty walking, numbness, and tingling in the lower extremities.
Yeah, so you mentioned, if someone does have an enlarged ligament, how is it diagnosed? What exactly does it mean?
Well, it's typically diagnosed by clinical symptoms, and then once the suspicion is there, you have to see a spine health specialist to get an MRI of the lumbar spine, which will clearly show this thickened, enlarged ligament.
Well, we recently spoke with one of your patients who you have helped find relief, and we're going to hear from Mary Ann right now with a little preview of how it helped improve her life by getting the mild procedure from Dr. Coleman. Here's a preview.
I really started having problems with my back and my legs, my lower back and my legs, my hips.
Let's talk about that, how it affected your quality of life and what that was like living with that chronic pain every day.
You just feel very like you should just stay home, which I refused to do. But it was a very uncomfortable feeling because it was chronic. Whatever I wanted to do, if I wanted to play tennis or if I wanted to dance or whatever I wanted, I knew I'd have pain. And I did fight through it. I would do it anyway. I was determined I was going to do it anyway. But then it started getting worse again, and that's when he told me he had something that he thought could help me, and the mild procedure. And I said, fine. He said it would be minimally invasive. I said, I don't want surgery, and I don't want to take narcotics. And he said, well, this is the thing for you. It has given me freedom that I didn't think I'd get back. I can do anything I want to do. I'm just like a new person.
And to hear Mary Ann say she's just like a new person, and when she got to see you at the office the other day when we were there, she just always is so grateful that you are in her life and you helped transform her life. And we're going to hear more of Mary Ann's story in a little bit. But first, let's walk through the symptoms patients might see and what with LSS typically.
Sure, kid. As I was stating in the previous segment, LSS, or lumbar spinal stenosis, is caused by an enlarged ligament in the back of the spine. And you can think of all of the nerves for the spine as passing through a straw right down the center of the spinal canal. So naturally, if there's an enlarged ligament there and you stand up, it buckles into that straw and kinks off the nerves, essentially causing a pinched nerve sensation. So naturally, these patients, they try to gain relief by leaning forward. And while we have a lot of data on the prevalence of this disease, you don't have to be a scientist to see in your community how prevalent this is. You simply go to a grocery store and you'll notice there are lots of folks that are leaning over on the shopping cart, and that's how they gain relief. And the longer they walk, the more pain they have. So increasingly, they try to lean down more and more. And one way they get relief is this shopping cart. So we always talk about the shopping cart sign. And I ask my patients in my clinical visits, do you find yourself leaning over on shopping carts when you're in the grocery store?
Yeah, so that might be an indicator that this procedure would be helpful for you. I mean, I just still can't get over Marianne's testimony and how much this procedure has changed her life. I mean, is this something that you see with so many of your patients with these pain and mobility improvements?
Absolutely. It's with the aging American population, spinal stenosis is endemic. It's something like 72 million Americans report chronic low back pain that radiates into the legs. So this is a huge part of the population. The unfortunate thing is so many folks don't really have a proper diagnosis, and they don't even recognize that a thickened ligament can be the cause of their pain.
Well, I feel like a lot of people maybe watching at home saw this demonstration and said, oh, that's me at the grocery store, or that's a loved one at the grocery store. So now let's talk treatments and how you can treat that.
Sure. Yeah, so what I highlighted in the earlier segment is the mild procedure. And the mild procedure is a minimally invasive, FDA-cleared procedure that is done through an incision that's about the size of a baby aspirin. And with proprietary tools and under local anesthetic and a light sedation, pieces of that enlarged ligament are removed to create space in the lumbar spine. So when these patients stand up, there's no more buckling and there's no more pinching of nerves.
So much better for quality of life, you know, especially with elderly folks that have, grandkids, and you want to be able to enjoy, the time with them.
And Marianne's going to talk more about getting that part of her life back. And still ahead here on Good Morning Washington, we're taking you inside Dr. Coleman's office to learn more about the mild procedure. And remember, you can find a doctor right now that offers the mild procedure just by visiting knowyourbackstory.com. We'll have much more of our spotlight on back pain next on Good Morning Washington.
Pain Awareness Month on Good Morning Washington is sponsored by Know Your Backstory.
We are back with Dr. Mark Coleman learning about the mild procedure, which is helping people with chronic low back pain. So why don't we take a little bit more time to focus on the mild procedure and what a patient is going to experience from the moment they walk inside the door?
Sure. The mild procedure, I counsel my patients preoperatively that, listen, this is not going to be a major surgery for you. This is an outpatient procedure. They are sedated with a light sedative. This is not general anesthesia. The pain relief comes in the form of a local anesthetic. The patients really don't, much in the way of a colonoscopy, they don't remember anything about the procedure itself. It is generally not painful in recovery. No strong analgesics are needed. And as a part of the procedure, there are there's no hardware that's left behind. There's no heavy medications that are needed afterward.
It's just a small incision.
Yes, a very, very small incision through which we insert proprietary tools that help debulk that enlarged ligament.
Well, I recently had the chance to visit Dr. Coleman's office and learn more about the procedure and how it's all done in one visit and under an hour. Take a look. Well, I'm with Dr. Coleman right now, and we're here at your clinic. I want to talk about one of your patients that you've been helping live a better life for decades, and I know you're so proud of this story. So tell us a little bit about it.
Yeah, well, I met Marianne about 15 years ago, and at the time, this was a very, very active woman, but progressively she had some compromise in her activities of daily living, particularly her standing, her walking, and she loved to do her Pilates classes. And she increasingly was unable to do those things due to severe low back pain that was shooting down into the legs. So she had seen an orthopedic surgeon who said, well, you've got some problems here, but surgery is the last option for you. Why don't you see a pain management physician? So she came to see me, and the rest is history.
Well, that's wonderful. Before we go into how you helped her, why don't you walk us through kind of what our traditional spine, what our spines look like when we're young and healthy, and as we age, what they start to look like?
Sure. Okay, so when I'm with a patient, About 20% of the U.S. population has low back pain, but unless you've had specialized training and anatomical training as well, you don't really understand what are the components that can cause low back pain. So I start off by telling them that the spine is made up of bones separated by soft discs, and the soft discs allow patients to have motion in the spine. In the back of the spine, there's this bony arch that protects the neural elements, the nerves that go from the brain down to the legs. So when we're young, these discs are very thick, there's a lot of separation between the bones, and the canal is very open, so there's no pinching of the nerves. Now fast forward to age 65, and spinal stenosis, the disease that I'm talking about, it's not really a disease, it's a condition of wear and tear. And as we age, those discs that I talked about before are no longer thick, they're thin, and they invaginate into the spinal canal. You get arthritis in the back where the bones connect, and that makes these bones very heaped up, which causes pinching both on the sides where the nerves exit, and particularly in the center of the canal where the ligament can become enlarged.
And so that's where the pain starts, and you kind of explained it to me as if a straw was clogged. Think of it like that.
That's how I explain it to patients. There's a very narrow canal through which the nerves exit out to the lower extremities, and when that nerve canal is pinched down like a straw being pinched, that's when the patients get symptoms.
So Dr. Coleman, there is actually a procedure that you helped Marianne with that can be done right here in this clinic.
Yes, it's called minimally invasive lumbar decompression, or mild. It can be done in less than an hour, and it involves inserting some very small tools into the spine where we can debulk this ligament or thin the ligament and unkink the straw.
And we've heard Marianne say it changed her life. I want to look at her MRI, and it kind of shows a little bit of just how bad it was.
Sure. Well, I have her MRI here, and this is when she first presented to me. And similar to the models that I showed, the spine is made up of bones separated by these black discs. And this lower disc is what you would expect in a healthy individual. But as you can see, as we go higher up in the spine, the discs get very narrow. And the ligament becomes thickened in the back here. This is that black stuff here. When I say the straw, I mean this white stuff here. And as you can see, this straw becomes kinked at several different levels within the spine. And this is what was causing all the symptoms. And by taking a little bit of this ligament down with a minimally invasive procedure, the axis of which is the size of a baby aspirin, I could thin out that ligament and give her great relief.
For people that are sitting at home watching right now that maybe have tried other things and think, I can come into Dr. Coleman's office and my life could be changed, what's your message to them?
My message is, number one, see a qualified healthcare professional that utilizes the mild procedure. And you can find that individual by going to knowyourbackstory.com and putting in your zip code, and a list of physicians who are interventional pain management physicians will come up, and you can select one near you.
Great. Thanks, Dr. Coleman.
I feel like I'm learning so much. I mean, such a great, education as well. So obviously we've seen, the effectiveness of this procedure. But what other procedures does a patient with low back pain, what they may receive?
Sure. When we first see a patient, we typically start at the beginning, and there's a whole algorithm and guideline that occurs in terms of our treatment pathway. So early on, patients may get treatments like physical therapy, medications, they'll advance to injections, and then if all of that doesn't work, then we'll offer the mild procedure, which again is a very short outpatient procedure.
Yeah, and speaking of that, coming up next here on Good Morning Washington in our Spotlight on Back Pain, one of Dr. Coleman's patients shares how she went from always being in pain to finally feeling relief after the mild procedure.
And remember, to find a doctor right in your neighborhood, it's so easy. If you want to find an office that offers this mild procedure, all you have to do is visit knowyourbackstory.com right now. In the upper right-hand corner, just click on Find Your Doctor. It's so easy to do. We'll have more as Good Morning Washington continues.
Pain Awareness Month on Good Morning Washington is sponsored by Know Your Backstory.
Welcome back to our spotlight on low back pain, where we are learning about the mild procedure that's helping people who suffer from chronic back pain.
Yeah, and I recently had the opportunity to catch up with one of Dr. Coleman's patients who shared how the mild procedure changed her life. Take a look. So, Marianne, it's great to be here with you today. Tell me about your back pain symptoms and how it all started and how many years you dealt with it.
I remember about 25 years ago when I really started having problems with my back and my legs, my lower back and my legs, my hips. And, you know, it just continued, and I would get some pain medicine from the doctor, or they'd occasionally tell me to go to physical therapy, and I would do that. After seeing different doctors, I went to one doctor, an orthopedic surgeon, and he told me that he said, I won't do surgery on you until you come crawling in here. He said, because you're too active. He said, but I will refer you to pain management. And I said, fine. So that happened to be Dr. Coleman. And I've been with him ever since, and it's close to 20 years I've been seeing Dr. Coleman.
Well, tell us about the mobility issues that started to take effect, and was it difficult to stand and walk and all the pain, the things that you went through?
You know, it was just a chronic pain that I had down my neck, down my shoulders, and my arm. So that, you know, I just had chronic pain. I always hurt.
Let's talk about that, how it affected your quality of life and what that was like living with that chronic pain every day.
You just feel very like you should just stay home, which I refused to do. But, you know, it was a very uncomfortable feeling because it was chronic. Whatever I wanted to do, if I wanted to play tennis or if I wanted to dance or whatever I wanted, I knew I'd have pain. And I did fight through it. I would do it anyway. I was determined I was going to do it anyway. So I did all those things with pain, but Dr. Coleman and the injections helped me so much that I was able to be more comfortable. But then it started getting worse again, and that's when he told me he had something that he thought could help me, and the mild procedure. And I said, fine. You know, he said it would be minimally invasive. I said, I don't want surgery, and I don't want to take narcotics. And he said, well, this is the thing for you. And so, you know, it was minimal, and it was just, I don't know, a little tiny cut. And then I was only in the office, I guess, for an hour or something like that. And then I had to, you know, I had to take it easy for a couple of weeks and not do some of the things I wanted to do. So that has brought me back to life, so to speak.
Well, yeah, so minor procedure. Tell us about that day of the procedure and the recovery.
So I had gotten the same position that I did for the injections, and I think it took maybe a half an hour for the whole procedure. And I went home that day. I needed a driver, of course. I went home that day, and maybe just a little bit of, you know, I knew I had something done. But they said you could put ice on it. I didn't even have to do that. I didn't. He said take it easy for a couple of weeks. I mean, that was it. I didn't have any feeling of anything except I felt better. And he just helped me, and the mild just helped me so much.
Wow.
I can't tell you. I mean, I feel like a person who doesn't have any aches or pains. It has given me freedom that I didn't think I'd get back. You know, I can do anything I want to do within reason. I still take medicine. I still go to physical therapy. I go to acupuncture. I still do all of those things. But collectively, and you know, I'm just like a new person.
What advice would you give people who are currently living with back pain at home and feel like there's no hope?
Well, first of all, they have to open their mind and say, and agree to maybe try some things that they've never tried before. And of course, I'm open to that because I want to live as long as I can, but I don't want to live and be uncomfortable. And so I would just say to them, you know, follow the doctor's orders, take a chance to do some of these things, see what happens, but, you know, give it time and have an open mind. And, you know, I'll say, well, you know, they'll say, well, my doctor said I can't have this, I can't do that. Well, you know, I know they can always tailor something to the individual. So, you know, I would just say talk to your doctor, talk to your, you know, maybe you go to physical therapy, whatever you do. And, you know, see if you're open enough to try to go to pain management, because I always refer them to pain management. I don't care where it is, if it's here or anywhere. So, you know, I can't say enough about pain management and what it's done for me. I really can't. It makes me feel so good inside because I didn't think I'd be at this point. So I'm very happy.
My goodness, you've changed her life. You know, and I think so many of our viewers probably are right now feeling the exact same way that Marianne was. Is this something, though, that you see typically with all of your patients getting this kind of relief?
Well, I find with the properly diagnosed patient who's had the proper MRIs and the proper evaluation, yes, it is.
Wow, that's wonderful. It's the mild procedure. And is the mild procedure covered by insurance and Medicare?
Yes, the mild procedure is covered by Medicare, Medicare Advantage, the VA, military, IHS. Now, for commercial insurance, you have to look because every commercial insurer is a little bit different, so I would encourage patients to check into their insurance coverage.
Wow.
Wow. All right. Well, we have covered so much today. And coming up next, we have a few more of your questions. But first, to find a doctor in your area that offers the mild procedure, you can visit knowyourbackstory.com right now. And there you will find more resources and an entire directory of physicians in your area. We will be right back. You are watching Good Morning Washington.
Pain Awareness Month on Good Morning Washington is sponsored by Know Your Backstory.
Back here with Dr. Mark Coleman, and we have a couple of viewer questions for you right now. And Jessica from Falls Church says her mom suffers from years of bad back pain. What is the first step in identifying the problem?
Well, the first step is get a proper diagnosis. Either see your primary care physician or see a spine health specialist. Now, a lot of people don't know what a spine health specialist is. Typically, a interventional physiatrist or an anesthesiologist with specified training in interventional pain management.
Yeah, and that's where knowyourbackstory.com comes into hand. Tim from Gaithersburg wants to know the best way to choose a doctor when it comes to the mild procedure.
Well, you want to look for physicians, again, in those two specialties who have had training in the mild procedure and are adept at the evaluation of spinal stenosis, reading MRIs, and the execution of the procedure.
Doctor, thank you so much for joining us. And visit knowyourbackstory.com right now to learn more about the mild procedure. And we really appreciate your time. I know there are so many patients that you've already helped, and we heard Marianne's story. We thank Marianne for her time. And I know you and so many doctors in the area can help with the mild procedure. Knowyourbackstory.com is the website. We'll see you back here tomorrow at 10 a.m. right here on Good Morning Washington. Have a great day, and thanks for watching.